Healing the body from trauma, how emotional defences shape movement and health. Hi, I'm Dr. Tony Weston. Today we're exploring how our psychological and emotional defences, often rooted in trauma, manifest in the way we hold and move our bodies. Trauma shapes not just our minds but our physical movement, posture and alignment, leading to long-term health issues like injury, tension and illness. The impact of trauma on the body. When we experience trauma, particularly in childhood, it affects both our emotional and physical well-being. The body learns to defend itself by bracing, tensing, or even freezing certain muscle groups. These physical responses are survival mechanisms designed to protect us. But when they become chronic, they manifest as injuries, chronic pain, or even illness. For example, trauma responses like fight, flight, freeze, or fawn cause physical changes. Someone in a chronic fight response might clench their jaw or tense their chest, preparing for conflict. Meanwhile, someone in a freeze response might lock their muscles, particularly in the neck and shoulders, leading to long-term stiffness and pain. Attachment styles and physical patterns. Our attachment style developed in childhood also impacts how we move and hold our bodies. An anxious attachment style might lead to jittery, hyperactive movements, while avoidant attachment might manifest as physical rigidity, creating distance from others through stiff postures. Disorganised attachment, often linked to complex trauma, can lead to erratic, disconnected movements as the body struggles to find balance and safety. These patterns are not just emotional, they're embodied, shaping how we stand, walk, and even breathe. Emotional defences and health consequences. Emotional defences like rejection sensitivity or hypervigilance can lead to specific postures or movement restrictions that build over time. For instance, someone who chronically suppresses their emotions may develop tightness in their abdomen, causing digestive issues or back pain. Similarly, those of us with rejection sensitivity may hunch forward as a way to physically guard against emotional pain, which over time can cause spinal misalignment and joint issues. These physical patterns, reinforced over years, lead to wear and tear on the body, manifesting as chronic injuries, muscle imbalances, and even autoimmune conditions. The mind-body connection is profound, and unresolved trauma literally shapes how we move through the world. Releasing trauma from the body. The good news is that we can unlearn these patterns. Recognising the link between trauma and physical tension is the first step. Practices like trauma-informed yoga, somatic therapy, and body-oriented psychotherapy help bring awareness to where the body is holding trauma. Through these methods, we can release the stored tension, allowing the body to move more freely and naturally. Mindfulness techniques, such as body scans and breath work, help us become aware of chronic tension and give us the tools to consciously release it. Working with the body in this way not only heals physical pain, but also helps us process and release the underlying emotional trauma. The role of therapy and mindful movement. Psychological therapy, particularly those focused on trauma and attachment, is essential in unlocking these patterns. By addressing the emotional root of physical tension, we can allow the body to let go of its defensive postures. Therapy helps to reframe the fight, flight, freeze and fawn responses, enabling the body to respond with calm and relaxation rather than chronic tension. On the physical side, mindful movement practices like yoga or Pilates can retrain the body to move fluidly, releasing old patterns and avoiding further injury. These practices restore the mind-body connection, helping us move with more grace, flexibility and ease. Here are some practical techniques for immediate relief. Let's talk about practical steps you can take today. Simple body awareness exercises, like doing a full body scan, help us identify where we hold tension. Breathing deeply into those tense areas encourages relief. Gentle stretches, particularly in the neck, shoulders and back, can alleviate long-held stress from trauma responses. Additionally, integrating small mindfulness movements into our day, such as pausing to notice how we're sitting or standing, can help break the cycle of tension before it becomes chronic. So in conclusion, here are some final thoughts. By understanding how trauma shapes our bodies, we can begin the process of healing both emotionally and physically. Releasing these defence mechanisms doesn't just lead to better posture and less pain, it opens the door to emotional freedom and a more resilient, balanced life. Healing is a journey, and it begins by recognising the profound connection between mind and body. Thank you for watching, and remember that healing your body is healing your mind. If you've enjoyed this, please like, share and subscribe for more content on living a happier and healthier life. See you soon.